The biggest change in Wexford General Hospital since the introduction of Lean has really been the fact that we're now working as a multidisciplinary team when we're approaching complex problems in services. Prior to this, there was probably more management-led approach to problems, which worked very well maybe for simple just do it solutions. But with the more complex systemic problems that we're dealing with all the time now in healthcare, the structure of the Lean management or the Lean methodology to approach problems and working as a team is proving way more effective and sustainable in Wexford General Hospital, and that's been our experience so far. I believe personally that the biggest change and the most important change since we started engaging with Lean is the use of data and the use of data as a visual aid to understanding information. Up until then, we probably were using a limited amount of information coming from NICWIS and IPMS and other sources of information that we have in the system. But now we're really engaging a lot more, using it to help people understand and to understand ourselves what's happening in our own service. And with this data and being able to visualise the data, break it down, make it simple, what this approach has done is really allowed us to evaluate our services and see how we can improve them. And it's not a management tool; it's a tool for everybody. Frontline staff now are engaging with visual data and presenting it to us, and we're presenting it to them. And it's definitely, I think, one of the most important changes that's happened. We've had some really great rapid improvement events, and that have brought some great improvements in patient care in the hospital. One I'd like particularly to talk about is one that was just presented out to us on Friday, and this was an A3 exercise done by a small group of people in the radiology department of Wexford General Hospital. So they looked at the time from ED to CT scan of patients who may or may not need thrombolysis. So through their project, they reduced that time period from greater than 30 minutes down to an average of 15 minutes. And the potential improved outcomes for patients by gaining that 15 minutes is enormous. This whole process has brought enormous benefits to the staff at Wexford General Hospital in every department. I suppose what happens in hospitals sometimes is people try to solve problems by themselves without realising the impact it may have on another healthcare professional's role in their department or another member of staff, whether it be like orderly security, housekeeping, catering, and we can try to solve problems in isolation, and then the solutions aren't sustainable because they have an impact on somebody else. What's been fantastic about with the Lean methodology and the rapid improvement events is it's bringing the larger multidisciplinary teams together in the hospital, and everybody's working together, seeing everybody's role in service delivery and improving service delivery. What I think also was another positive of this multidisciplinary approach is also it's built more respect between all the disciplines of the role of everybody within the service, and what the process mapping and the structure around Lean once again allowed people to look and evaluate their own services and come up with solutions.